first on the phone in, why does Scotland struggle so badly with substance misuse? 08085 92 95 00.
Your calls, your stories.
Mornings with Kaye Adams on BBC Radio Scotland.
Well, as I say, the latest figures will be released around 9:30 this morning, and of course we will bring them to you as soon as we're aware of them, but no one is expecting good news. For 3 years, Scotland has had the highest rate of drug deaths in Europe. That's ahead of Sweden. As an example, the rate of drug deaths per million in England and Wales and Ireland's a similar level, roughly around 77 per million. In Scotland, it is 295, so you can see the gap there. And it begs the question, why? Why is that the case? Is it our environment? Is it our culture? Is it our treatment services? Why is substance abuse such a Scottish problem? And I'm just going to finish with Austin Smith, who's a policy officer at the Scottish Drugs Forum. Good morning to you, Austin.
Good morning.
As I say, we've heard it from various people that the pathway to getting off drugs, it seems to be fraught with obstacles. Is that the case?
Yes. What we have to, the big picture here, Kaye, and thanks for this coverage this morning. It's been very useful and far, far better than where we were a few years ago in terms of the level of the debate. We now, the figures this morning confirm that we have a death every 7 hours in Scotland. And what's behind that and what drives that is a very high rate of problem substance use. So around about 1.1% of the population has a problem with heroin or benzodiazepines, and these deaths are mainly amongst that population. So 94% of these deaths are in poly drug use, so people using more than one substance. And people in that situation, so it's that group of people, not to stereotype people, but that group of people that people are maybe familiar with in terms of seeing people around in the street and in the communities, it's that group of people who are most at risk. And what those people face in terms of engaging with services is just like no other NHS patients. If we just think of people as normal NHS patients like everybody else, what do they face? Long periods of waiting, mucking around, frankly, at the beginning of the treatment experience. And then when you get into the treatment experience, a lack of choice in treatment, a lack of choice even in terms of substitute prescribing. What medication can you get? It's often just one medication in offer. And then progress with that, other supports that you might need around your own physical and mental health, just simply non-existent or provided in a way that it isn't accessible to you. It reflects very poorly on service provision.
Austin, do you mind? We're really short for time. We've got a statement from the Public Health Minister, Joe Fitzpatrick, which is quite lengthy. I'm going to try and read it as quickly as I can and hopefully have time to give you just an opportunity to respond. So if you don't mind, I'm going to speed read here. The Scottish Government is doing everything in its powers to tackle rising drug deaths. We're working urgently to put in place high-quality, person-centred services for those most at risk. The Drug Deaths Task Force Forward Plan outlines longer-term interventions we're putting in place to tackle this problem. Significant progress has also been made in meeting the commitments set out in our alcohol and drug strategy. For example, the new Residential Rehabilitation Working Group is continuing its work to ensure access to residential rehabilitation services for everyone who needs them. These deaths stem from a long-standing and complex set of challenges. There's no shortcut that will solve it. However, action we're taking right now will have an impact more immediately, such as maximising the availability of Naxalone and the routes by which it can be supplied. I'm not going to get through much more without giving you a chance to reply, Austin. I mean, do you feel significant progress is being made?
No, but he's right. There is an impetus for change, and that's very, very recent and welcome. But what we need is just a huge expansion in services, and that just isn't happening at present.
Okay. Sorry we didn't have a lot of time there, Austin. It's something we definitely should discuss again. Austin Smith, the Policy Officer at the Scottish Drugs Forum. And I'll read the statement out in full after the news so that you've got it all there.
On digital radio,
FM,
your smart speaker,
and BBC Sounds.
BBC Radio Scotland.